You're not alone. Samuel Holy is one of the lucky ones. He was able to break his years-long cycle of drug and alcohol addiction, incarceration, and family violence. But there are many who are not as fortunate as Samuel, and that is having a devastating impact on Hawaii's keiki. Whether it's violence in the home, the effects of the pandemic, or other factors, young children are needing more mental health support than ever before.
We have 29,000 keiki under 5 that need mental health supports, and that early attachment, those early skills on how to regulate emotions are really important for learning. And when they don't get those skills, they enter kindergarten and they really struggle.
Erin Henderson Lacerdo is Executive Director of the Association of Infant Mental Health in Hawaii.
So parents really could be concerned about their child's mental health development as early as during pregnancy. So when mothers are pregnant, they transfer lots of nutrients and lots of hormones over to their baby, and that includes the stress hormone. And so when pregnant mothers are incredibly stressed, that really does actually transfer over to the baby, and that can impact the baby's development later in life, where they have a harder time regulating their emotions, or when they're really stressed, they don't calm down as easily. And so those kinds of things actually can be impacted by what's happening during pregnancy. And so during those first 1,000 days of life, after the baby is born, which is about the first 3 years, that really is a critical point where we watch all these milestones happening for babies. We see them crawling, we see them looking, we see them starting to talk, and we expect those things to happen. Just as they're developing all of their developmental stages, they're also developing their own mental health as well. And so parents really have this wonderful opportunity in these first few years of life to really impact the patterns that are going to be set for a lifetime.
What about a caretaker's impact on their baby once they're born?
When their caregiver is able to feel confident in their ability to care for this child, or to provide a safe environment, an emotionally safe environment, then that child will be much better off. And so when a parent is impacted by the day-to-day stress of life, whether that be trying to make the bills, traveling to a job that's miles away through traffic, and we all know how horrible that can be, parents can carry all of that home with them, and they become less patient and less kind and less nurturing and less willing to just really sit with some of the big feelings that our infants and toddlers have. And so it's really, really important and critical that parents don't forget the important, crucial role that they have. And that role is really to help develop that immature nervous system that we were talking about, where babies don't know yet how to emotionally control themselves or keep that tantrum from happening. They're still learning all of those things, and they learn that through the support of a nurturing and responsive caregiver.
And many families wrongly believe that infants will be fine following stressful or traumatic experiences.
They're resilient, they're fabulous, they're great little things. And when we don't have to do a lot in order for them to develop on a normal pathway. And what is really the truth is that children are definitely listening. We tend to think, oh, babies, they don't remember. They're fine, they can't talk. They don't remember the fights that we've had. They don't remember the time that we moved suddenly. They don't remember some of the things that happened to our family. And actually what's happening is because, once again, the brain development is happening so critically at this time, it's actually being laid in the baby's brain, the baby's groundwork for the future. And so babies really aren't gonna just be okay all by themselves. They really are gonna need support, especially if they're experiencing any kind of adverse childhood experience that might then lead to unfortunate health outcomes later in life. Perhaps it was a car accident. Maybe it was a big fight. Maybe even it was a dog bite, maybe. Sometimes the things that we believe are kind of everyday things can actually be really, really scary for little babies. And so babies might express that in different ways. Sometimes they might turn more internally, and they might not cry as much. They might do the exact opposite, and they might cry more often. They might not sleep well. Anytime that there's a concern that you have, you really should reach out to a professional. So basically, I think at the end of the day, it's really just reach out to somebody. Don't worry about somebody judging you or feeling like, why are you asking me these questions? Your child is fine.
And in the wake of the pandemic, older children aged 5 to 11 are also showing a decline in social and emotional development and experiencing more mental health issues.
And part of that is due to isolation during the pandemic, not having exposure to other peers and other family members. It's the increased stresses for families, whether it's economic stresses, it's homelessness and housing insecurity.
So not only are we seeing children having greater needs and families having greater needs, even when it comes to mental health and other kinds of resources that would help them be stable, but we're also seeing our children in greater need with coming to our programs with more ground to cover, I guess, than in past years. And a lot of that is because of the COVID pandemic.
To compound the problem, there is a severe shortage of mental health providers and services for young children.
We're about 40 to 45% of, I guess, our mental health care shortage affects our young people. We just are really short on providers. Right now, it's really hard to find a adolescent or a child psychologist or psychiatrist anywhere except for in Honolulu, and even then you're going to wait. These things can't wait.
As part of his budget package, Governor Josh Green is proposing a loan forgiveness program to attract more doctors and mental health care workers to Hawaii. He's seeking $10 million in fiscal year 2024 and $20 million the next fiscal year.
That will create up to 900 additional healthcare workers in our state per year. They will get their loans forgiven if they stay and work in areas of need. That is really the solution. It makes a big difference because for a long time, we've seen the healthcare system kind of fray at the edges, and mental health care is the first thing to go. But in truth, mental health care is primary health care.
Green also wants to establish a program within the Department of Health to provide and coordinate mental health services for children from birth to age 5.
What can we do to help children who are wrestling with violence at home, with parents that might have addiction issues, and they then suffer a lot of developmental problems? Well, what we can do is we can get like early childhood or even adolescent mental health care into kids' lives. If we do that, then they don't end up suffering and ending up in peril, in jail.
Green's infant and early childhood mental health bill is currently moving through the legislature. The governor also would like to see expanded mental health services in Hawaii's schools.
We also saw a lot of people tilt to self-harm during the pandemic. There was a lot of worry about suicide, especially in some of the neighbor island communities. We saw spikes that were really scary. We have to invest early in people's well-being. So putting together a lot of extra service for young people, for their mental health at schools, big deal.
Beefing up support for Hawaii's youngest Keiki is a top priority for Green because of his own childhood experience.
I was deaf at birth, and a lot of people don't realize that, so I didn't have early opportunities. They thought I had disabilities, and really what it was, I couldn't hear.
Green says he was lucky to have his disability addressed early through surgery.
But I had to catch up, and so it took me until about age 8 to catch up, and so I can imagine how difficult it is for families that don't have resources to not have screening, to not have access to early education, to catch up. You really will never catch up if you don't have extra support.
So for us, mental health supports are foundational for our youngest Keiki to make sure that they have an opportunity to learn in ways that are similar to their peers. Otherwise, they're going to stay behind.
Because really, we want to let you know that you aren't alone in your worries and your concerns, that there are lots of children who experience challenges, and that there are lots of parents who really just want the best for their children. And when you want the best for your child, it's okay to ask. It's really okay to ask for some support and for some guidance, and just know that there's people who want to help you.
For more information, go to aimhhi.org, aimhigh.org. But childcare and early childhood education are hard to find for thousands of parents across the state. Many parents simply can't afford early childhood support. And that is one reason why Commit to Keiki was created.